Good evening. As a parent, one notices many scrapes, bruises, and even swellings on their child. More often than not, these markings are a result of no more than children at play. Yet what if one of these indicated something more? I was only 10 when a small growth appeared near my right collarbone and meant just that. In fact, this painless swelling was a symptom of Hodgkin's lymphoma. Hodgkin's lymphoma facts medical author Melissa Conrad Stopler defines Hodgkin's lymphoma as a type of lymphoma, a cancer of the lymphatic system. The lymphatic system is part of one's immune system. Our immune system fights infections and other diseases. This type of cancer begins in cells of the immune system. The importance of this information on Hodgkin's disease is to inform and educate children, parents, and people of all ages about this type of cancer in hopes that it will have them become more familiar and knowledgeable about it. Today I would like to share what I have experienced and learned about Hodgkin's disease, including its symptoms, how it's diagnosed, and its treatments. Hodgkin's lymphoma, which can be referred to as Hodgkin's disease, is a cancer of the lymphatic system. The lymphatic system includes lymph vessels, lymph nodes, and other parts, such as tonsils, thymus, and spleen. Lymphatic tissue is also found in other parts of the body, including the stomach, skin, and small intestine. Because lymphatic tissue is in many parts of the body, Hodgkin's can be started almost anywhere. Usually it's first found in a lymph node above the diaphragm, but Hodgkin's lymphoma also may be found in a group of lymph nodes. Sometimes it starts in other parts of the lymphatic system. In Hodgkin's lymphoma, cells in the lymphatic system grow abnormally and may spread beyond the lymphatic system. As Hodgkin's lymphoma progresses, it compromises the body's ability to fight infection. There are many signs and symptoms of Hodgkin's. The signs or symptoms include painless swelling of lymph nodes in one's neck, armpits, and groin, persistent fatigue, fever that does not go away, soaking night sweats, itchy skin, coughing, trouble breathing, or chest pain, an unexplained weight loss, loss of appetite, or an increased sensitivity to the effects of alcohol. Most often these symptoms are not due to cancer. Infections or other health problems may also cause these symptoms. Anyone with symptoms that last more than 2 weeks should see a doctor so that problems can be diagnosed and treated. If one has swollen lymph nodes or another symptom that suggests Hodgkin's, a doctor will try to find out the cause. In order to do this, an examination and some testing will need to be done. Once completed, the type of Hodgkin's and stage can be determined. The types of tests and procedures used to diagnose Hodgkin's lymphoma include a physical exam, blood tests, imaging tests such as an X-ray, CT scan, or an MRI, and a biopsy. A biopsy is the only way to diagnose Hodgkin's lymphoma. The doctor may remove an entire lymph node or only part of one. This will determine if Hodgkin's was found, the type, and what stage the cancer is in. Hodgkin's lymphoma is one of 2 common types of cancers of the lymphatic system. The other type, non-Hodgkin's, is far more common. Doctors need to know the extent or stage of Hodgkin's lymphoma to plan the best treatment. Staging is a careful attempt to find out what parts of the body are affected by the disease. Stages of Hodgkin's lymphoma include Stage 1. The cancer is limited to one lymph node region or a single organ. Stage 2. The cancer is in 2 different lymph nodes, or the cancer is in a portion of tissue or an organ in nearby lymph nodes. The cancer is still limited to a section of the body either above or below the diaphragm. Stage 3, the type that I have. The cancer moves to lymph nodes both above and below the diaphragm. Cancer may also be in one portion of tissue or an organ near the lymph node groups or in the spleen. Stage 4 is the most advanced stage of lymphoma. Cancer cells are in several portions of one or more organs and tissues. This stage affects not only the lymph nodes, but also other parts of the body, such as the liver, lungs, or bones. The treatment options for Hodgkin's depends on the type and stage of the disease. The goal of treatment is to destroy as many cancer cells as possible and bring the disease into remission. The types of treatment used to fight this types of cancer is chemotherapy, radiation, or stem cell transplant. Chemotherapy is a drug treatment that uses chemicals to kill lymphoma cells. Chemo Chemotherapy drugs travel through the bloodstream and can reach nearly all areas of the body. Chemotherapy is often combined with radiation in people with early-stage classical-type Hodgkin's. In advanced Hodgkin's, chemotherapy may be used alone or combined with radiation therapy. Radiation therapy uses high-energy beams such as X-rays to kill cancer cells. For classical Hodgkin's lymphoma, radiation therapy can be used alone, but is often used after chemotherapy. Stem cell transplant is a treatment to replace your diseased bone marrow with healthy stem cells that help to grow new bone marrow. A stem cell transplant may be an option if Hodgkin's returns despite treatment. In conclusion, there are many symptoms, stages, and treatments associated with Hodgkin's disease that, as with all types of cancers, one can benefit from being aware of. The best course of action to take should one suspect this type of cancer is to seek the opinion of a doctor. Although a type of cancer, it may be helpful to know Hodgkin's disease does have a high success rate for survival for all stages. I am part of that statistic and proof.